Good day, class. In this video, we are going to discuss obesity. Obesity nowadays has become quite a common disease among different populations, different age, no matter from kids or adults. It's quite common now. So it refers to the overweight with excess fat accumulation, especially the BMI, so body mass index. We can use this to calculate the BMI, and this can indicate the diagnosis. So it's the weight divided by the square height. If above 30, then we consider as obese. This disease is not a new disease. Obesity in 黄帝内经 is described as the reason of this problem is because the patient is too well. So it says the patient eats fancy food. It's one of the reasons. Another reason also described in 黄帝内经 is the alcohol intake. So as you can see, this problem is not something recently. Since 黄帝内经, since 2,500 years ago, it is very not common, but also the practitioners already realize the causes of this problem. It's from one of the most common causes is from improper diet, the actual food intake, and alcohol intake. Apart from the diet, the innate problem we also need to take into consideration, especially if patient presents with the qi deficiency or phlegm dampness. So for obesity in Chinese medicine theory, we mostly refers to the qi deficiency, phlegm and dampness. But these two are actually the qi deficiency and obese. These two are actually vicious circle. We can't say which is the cause, which is the result. This is very similar to chicken and eggs. Which one comes first? Is it the qi deficiency comes first? Because the qi deficiency may result in water retention. It may result in the slow metabolism, and it will result in the accumulation of the fat. So it will result in overweight. But in the meantime, overweight will result in the spleen dysfunction, especially if the overweight is due to the improper food intake, improper alcohol intake will affect the spleen function. And so these two, we need to focus on both. The most common causes of this is the improper food intake, especially the excessive food intake and lack of exercise. So one is the inputs to the body, the other one is the outputs. The treatment for obesity, no matter from acupuncture or from Western medicine, it's all about what you eat, how much you eat, and what's the outputs that you actually conducting. For instance, if you eat more and you exercise less. In some very common situation in our daily practice, some patient will tell you, I want to lose weight, but I don't want to reduce my food. I don't want to exercise. So can you perform any treatments to help me to lose weight? In this situation, all what we can do is try to strengthen the spleen function, but the result is the efficacy will be very limited. Sometimes in this situation, I will discuss with the patient using a very obvious phenomenon. I will always tell them that It's very similar to the car you drive. You put a lot of oil, you put a lot of fuel in the car, but you don't drive the car. How can you get the fuel off? So either you don't put that much fuel in, or you drive more, which means either you eat more or you exercise more. So also either you eat less, the food intake, or you exercise more. So this can help you to lose weight. But in the meantime, from the treatment, what we can do, we can use the different technique to strengthen the function, especially with obvious causes such as the spleen deficiency, kidney deficiency, especially with water retention or phlegm or dampness. In this situation, we can have some treatments to assist. But no matter what kinds of treatments, food intake and exercise are very important. In this situation, patients also are more likely to present as a yang deficiency. Yang deficiency, although I have mentioned that's the qi deficiency, the phlegm dampness, spleen deficiency, when you write down all these different aspects, you will see these are actually links together. Yang qi deficiency, especially spleen yang deficiency, will result in water retention. Water retention is actually the dampness that we mentioned. The dampness is also very closely related to the phlegm. In the clinical practice, especially for obesity, we cannot distinguish dampness or phlegm. It may be the combination of both dampness and phlegm. For the obesity, when we see this kind of patient, we must differentiate with edema. Patients with edema, after treatments, the body weight can reduce significantly. I saw one patient previously. This lady was the combination of obesity and edema due to chronic heart failure. This patient, after treatments, within a few weeks, her body weight can drop 15 kilos from 115 to 98. So this is the edema because of the water retention. But from 98 until now, after a few months treatment, the body weight is still there. This lady was the height was not tall. It's about 1.56 or 1.55. So consider with the height, her height, and this weight, 97, that's obesity. But because the difference between the water retention and obesity, water retention, the weight can reduce dramatically in a very short period. Obesity, because of the fat, it will reduce in a very short time. For obesity, the etiology in Chinese medicine is we always think about the root cause and the manifestation. The root cause is the qi deficiency or yang deficiency. The manifestation may be the dampness and phlegm, or even blastasis, especially after long term. For the syndrome differentiation, these different syndromes, apart from the syndromes, we also need to identify which organs has been affected, such as the spleen, the kidney, or the lung and the heart. If related to the spleen, the patient may present as fatigue and chest oppress, nausea with phlegm. If related to the kidney, the patient may present as the weakness in the waist, the lower back, or the knees. May have short of breath, excess sleeping, cold sensation in the extremities, edema in the lower part of the body, especially in the feet. Night urination, so urinate a lot during their sleeping. So these are related to the kidney. If it is related to the heart and the lung, the patient may present as palpitations, short of breath, reluctance to talk, fatigue, spontaneous sweating. As you can see, these symptoms, sometimes it is actually the qi deficiency, sometimes it is the combination of qi and yang deficiency. The treatment principles. It depends on excess or deficiency. If excess, we're going to focus on the excess pathogens to relieve. Large intestine 11, summer 25, spring 9, summer 40, phlegm. Level 3, 忍耐。忍耐水风水 again we have mentioned quite a few times. 水 means water. 风 means separate, means this point can separate water, so you can use this points for edema. In this video, we mainly discuss the obesity, the treatments towards obesity. No matter what kind of treatments, it's very important to have the comprehensive management. So you need to advise the patient from the diet, from the exercise, and the treatment. The body acupuncture, you also can apply the electrical stimulation. So you can apply the treatment every day or every second day. Thank you for your attention.